you top-lined a lot of stuff that's going on there across the ecosystem, and I see all this fantastic outreach. Give us an example of one program that you'd like to highlight that you all are working on to further the cause in the ecosystem.
Yeah, happy to. I failed to mention earlier our work on health equity by design, and that's tied very closely to the US CDI and the introduction just in this last version of the inclusion of social determinants of health data, SDOH and SOGI data that helps to reduce healthcare inequities, and that ultimately we've seen result in health disparities. And this, I think, is based on not just what we've seen throughout the provider community, but also, again, with feedback from our federal partners, the firm and the VA among them. And one pilot program that we're really proud of is called the Leading Edge Acceleration Project, or LEAP. And we started that work a couple years ago, but this year's program is really exciting. It's based out of UT Austin, and as Ben mentioned, we are big proponents of fast healthcare interoperability resources, or FHIR, based approaches, and these are more advanced than some can adopt, right now across the continuum. But in the pockets where that's working and where there are private sector partners that understand how to navigate the tools, it's really a powerful way to advance the exchange of information in not only clinical context but also traditional healthcare environments. So health and human services at the state level, community-based organizations, federally qualified health centers. We hope this will be pervasive throughout the country, but this pilot is going to really help to pilot the referral management tools that are based on an accelerator out of HL7, Health Level 7 International, that we work really closely with. That is one way that we support semantic interoperability, again, that others have talked about. But we want to, and we really feel confident that this is going to help enable health IT for everyone, and to help with treatment, transitions of care, and referrals, so that the patient can take their information with them, and providers on both sides can get access to the information they need in a seamless, really non-obtrusive and privacy protected, also is important to mention, fashion, closed loop, truly closed loop, and again, all tied back to the baseline SDOH data that's all collected in a standardized kind of clean format. So that's one example we're really excited about. And another one I'll just mention is our partnerships with NIH and CDC and the US Digital Service to help, again, deploy FHIR-based solutions for public-private partnership purposes in the pandemic. And two examples, we probably don't have time to get into it today, to your point about needing a full day, but making the data from at-home COVID testing more readily available, and also making sure that patients and everyday people across the country can find out how to get whether it's vaccine information or whatever information they need at their fingertips.